go?
I'm good to go when you
All
are.
right, okay. So we'll count down from 5. 5, 4, 3, 2, 1, go. Hi, my name is Sheila Coon, and I'm a nurse at Novant Health, Women's and Children's Institute. And I'm excited to be here with you today to talk about osteoporosis, what's a body to do. As we talk about osteoporosis, the first thing we need to understand is what are our bones made of? Our bones are made up of collagen, which provides a very flexible network for your bones. There's also calcium there, lots of mineral complexes, and bone cells that both build and break down your bone. Your body stores 99.5% of all of the calcium in your body in your bones. And if you'll notice, we have peak bone mass listed up there. The concept of peak bone mass is that we will, as we're growing, develop the strongest bones that we will have in our entire lifetime, sometime between the ages of 18 and 25. And so while osteoporosis normally shows up in older adults, the foundation for osteoporosis is actually occurring when you're much younger. So for those of you who have children or grandchildren that you can influence, it's really important during that young adult age that they focus on building their bones up to be as strong as possible. When they have strong bones, then we talk about their bone bank being full. And as we age and as different things occur with our health, we will gradually lose some of the bone bank deposits that we have. So we want that initial bone bank to be as full as possible so that as we do naturally lose bone, that we won't put ourselves at risk for developing osteoporosis or osteopenia. So that brings up the question of what is osteoporosis and osteopenia? Osteopenia is a disease where the bone is beginning to be broken down, but as we measure it, and we'll talk about that a little later, the T-score range for that is a -1.0 to a -2.4. Osteoporosis is the actual disease where we have a T-score that's greater than -2.4, or you've had a non-traumatic bone fracture or break that will point providers to give you the diagnosis of osteoporosis. So bone is living tissue. It's constantly being built up and broke down. And we have 2 cells specifically that are involved in that. The first one is osteoclast. I always like to differentiate these using the C and the B. So osteoclast are chewing cells. So they chew and tear down, they break down your bone, releasing calcium into your system. Osteoblast with the B, they're the builders. They actually take calcium and all of the other components and they build your bone. And the goal here is that the action of the osteoclast and the osteoblast are equal or balanced so that we don't end up with excess bone loss occurring. So what is the disease of osteoporosis? It again is the disease that occurs when too much bone is being broken down and not enough new bone is being built. So on your left, you'll see a normal bone with lots of bone cells and mass in it. On your right, you can actually see a bone with a fracture in it, and you can also see that the bone has basically holes or places in it that aren't filled up with calcium. And that is what a bone that has osteoporosis would look like on an x-ray. Now, we had earlier talked about T-scores, and so I wanted you to understand that there is a DEXA, D-E-X-A test that is the most common way to diagnose osteoporosis. Your provider could order a DEXA for you if you all were concerned about your bone density. They also could order it if you have certain risk factors and if you're over the age of 65. The normal score for a DEXA is 0. And as the number goes into the negatives, the lower your bone score is, then the more chances that you potentially will have a fracture or a break. And again, if your T-score is a minus 2.5 or lower, then you would be diagnosed with osteoporosis. Now, if you are over the age of 50 and you have a non-traumatic fracture, say you just trip and lose your balance and fall down, and you break your wrist, you break your ankle, that would clue your provider in that they probably want to check out your bone density. If you were in an automobile accident and had several fractures, that isn't what we're looking at as far as potentially diagnosing weak bone. It's when you take a fall or a trip or a slip and you break a bone when other people normally would not. So how prevalent is osteoporosis? Well, this disease affects more than about 54 million Americans. Now, that isn't 54 million Americans being diagnosed, but we have at least that many that are at risk. And of the 10 million people in America that are diagnosed, 8 million of them are women. The other 2 million are men. And so, ladies, we are at a much higher risk for developing osteoporosis than men, but men do develop osteoporosis as well. Osteoporosis is known as the silent disease. You really don't routinely have any indication that you have bones that are that are not dense enough until you suffer a fracture or a break. However, there are some fractures that are extremely painful, and oftentimes that might be the first symptom that you have osteoporosis. Those are spinal fractures. Many times people complain because they have back pain, and then when that gets explored further, they find out that they actually have spinal fractures. If you notice that you're losing height or that you're developing a curve in your spine, those things also might clue you into talking with your provider about getting a bone mineral density test. So what can you do if you're wondering, how can I improve my chances of not developing osteoporosis, or how can I manage the disease if I do have it? Well, we need to understand what our risk factors are. We need to understand the things that we can do to improve our diet and our exercise to support strong bones. And then we also need to understand screening, testing, drug therapy, and also share this information with friends who maybe were not able to listen to this presentation. So here are some of the risk factors. So are you at risk? Yes, especially if you're female. Remember, 8 out of 10 people with osteoporosis will be female. If you are postmenopausal, or if you've entered menopause early, once a lady hits menopause, if she's not on an estrogen supplement, then she can develop accelerated bone loss up to about 20% of bone within the first 5 to 7 years after she's entered menopause. If you're Caucasian, Asian, or Latino, you are at risk, higher risk. If you take steroids or other specific drugs over long periods of time, these drugs can increase the osteoclast, or the chewing of the bones, and they can also block the osteoblast, or building of the bones. So chronic diseases that require you to take steroids, some of the autoimmune diseases, asthma, difficulties with breathing, there are many drugs that can interfere with your bone formation. If you have a petite frame, and most people think petite and they think short, but we're really talking a frame that has less weight on it. So in all actuality, all things being equal, a person who weighs more is going to have stronger bones simply because their body is carrying around more weight than somebody who has less weight on them. If you have a family history of osteoporosis, that increases your risk. And then if you'll notice, these last risk factors are in purple, and that's because while we cannot do anything about the risk factors we've already discussed, these risk factors we actually can do something about. And so if you have an inactive lifestyle, getting up and being more physically active is going to promote your bone health. If you smoke, you're at increased risk for osteoporosis. Also, if you drink, and alcohol in excess. And so for those two things, if you could decrease or stop smoking, or decrease or stop the excessive alcohol consumption, that would contribute to a better potential for bone health. And then if your diet is low in calcium and vitamin D, that's something that you can change to really focus on making sure you're getting the correct amounts of calcium and vitamin D in your diet to promote your bone health. So what are those calcium and vitamin D levels? Well, first of all, I just want to mention that in the literature, in the news lately, you might have been reading where there are some people who think that you shouldn't be taking calcium supplements. And also with vitamin D, should you be taking a vitamin D supplement? Should our providers even be checking vitamin D levels? Basically, what I did right before I prepared this presentation was look at some of the leading osteoporosis resources to see if they had changed any of their recommendations based on this conversation that's occurring not only in the public but in medical journals as well. Excuse me. And they had not. So the recommendations that you see on your screen come from the National Osteoporosis Foundation. Now that foundation has recently changed their name. They're now the Osteoporosis and Bone Health Foundation, but you can look them up under either of those names and you will be able to find amazing literature, information, suggestions, ideas for promoting and maintaining bone health, and also for understanding the disease of osteopenia and osteoporosis. So, calcium recommendations for women who are age 50 and younger are that you consume 1,000 milligrams of calcium each day from all sources. Please hear me when I say that the goal is that you consume all of the calcium that you need in your diet. So if you can manipulate your diet to achieve 1,000 milligrams of calcium each day, you do not need to take any kind of supplement. If you're 51 or older, it's 1,200 milligrams. For men, notice the age difference. Again, the age difference is because women enter menopause. The average age for menopause is 51. And so once we enter menopause, our risk for osteoporosis developing, because we're going to lose bone mass, increases dramatically, a lot more than what men experience as they age. So their age to begin a higher amount of calcium is about 20 years older than what it is for women. So men 70 and younger, 1,000 milligrams of calcium, and age 71 and older, 1,200 milligrams. Now there are some Key points to make here that are not on your slide. If you are pregnant, your calcium needs are greater. You're growing a baby and building bones and doing all of that stuff. And so the calcium recommendations are higher for women who are pregnant. Additionally, for young people up to about the age of 25, we want them to have at least 1,200 milligrams of calcium a day, because they are in the process of building up their bone bank and building their bones to be as strong as possible. We talk about vitamin D when we talk about calcium, and one of the things that people need to understand about why we talk about them together is because vitamin D, I like to think of it, it's the transport truck for calcium. So when you take vitamin D and you've got calcium circulating, it jumps on the vitamin D, and then the vitamin D transports it into the bone where it can be used to rebuild your bone. So you do need adequate vitamin D levels to support your bone health. For men and women, 50 and younger, it's 400 to 800 international units of vitamin D daily. And then 51 and older, 800 to 1,000 international units. Now, if you have your vitamin D level checked and it is not where it needs to be, your doctor might actually prescribe you a prescription of vitamin D where you're taking 25,000 international units a day for 2 months, or the levels vary. That would be up to your provider. But we actually do experience that we take large amounts of vitamin D over a specific period of time to get our levels back to normal, and then you would go back to just consuming the recommended daily amount at that point. So let's talk about calcium again specifically. 90% of the calcium that's in our body is in our bones and our teeth. Calcium is necessary for life. So calcium plays a role in nerve messaging, muscle contractions, your heart, your blood clotting, and we have to take calcium in. We do not produce it in our body. The best source for calcium is actually the food that you eat, and then you can take a supplement if you need it. Notice here the note under supplements. If you're going to be taking a supplement, don't take more than 400 to 600 milligrams of calcium at any one time. And that includes food with the supplement. So say that you have a calcium supplement that's 600 milligrams, and you take it in the morning when you're drinking a large glass of milk. Well, basically what you're doing at that point is consuming so much calcium at one time, your body will not absorb it. And so much of that calcium is going to be excreted in your urine. So you want to make sure, if you are relying on a calcium supplement, that you take that supplement at a time when you are not consuming a food source of calcium. And that way you're going to maximize your food sources and the supplement that you're taking. As you're looking at purchasing a supplement, I would just say, pay attention. We do not recommend that you take bone meal, oyster shell, or dolomite supplements. I should say supplements that have these ingredients in them. They're toxic. They have toxic metals and lead in them routinely. So you wanna take a supplement that does not have those ingredients. A lot of times, if you're worried about your supplements, you can look for a supplement that has the USP label on it. That's the United States Pharmacopoeia label. That label does give you some reassurance that the producers are following some basic guidelines for manufacturing, that if you had a choice between purchasing a USP labeled supplement and one that didn't have the USP label, I would recommend that you go with the USP labeled supplement. So let's look at food label, and then we're going to look at a supplement label. So understand, first of all, when you're looking at labels, so we're trying to figure out how much is in our food, how much do we need to supplement. The first thing you need to pay attention to is what is the serving size. So immediately under the nutrition facts, you're going to find something that tells you what a serving is equal to. So this is a hamburger label, and so these nutritional facts are based on consuming one burger. If you go all the way to the bottom, there's a thick black line, and then there are vitamins listed there. And as you can see, a burger has 4% of your daily nutritional requirement for calcium. So when you're looking at food values, you want to look at least for something that has at least 5% or more of your daily value when you're trying to focus on consuming a food product for a specific ingredient. If it's less than 5%, then that's considered a low source of that food, vitamin or mineral. Now let's look at supplement labels. This is very interesting, and I think a lot of people don't read the labels clearly or understand them. So we're going to start in the upper left corner. This supplement requires that you take 6 capsules to get 240 milligrams of calcium. So understand that to get to your 1200 milligrams, you're going to need to take about 24 capsules. That's a lot. That's a lot. So let's drop down to the label that's beneath that. This calcium supplement is 1 tablet, and it provides 600 milligrams. Now remember, we don't want to consume, more than 400 to 500 milligrams at any one time. So this one's 600. So you're going to excrete a little bit of this. However, it's also only 1 tablet. And if you have trouble swallowing, some of these supplement tablets can be really big. So you want to pay attention and think about, can I swallow as many as I need, or is the size too big, and instead of a tablet, do I need to look at a capsule? All of these things will play into whether or not you're actually going to take your supplements, or whether they're just going to sit in your cabinet and grow old all by themselves because you don't pay any attention to them. On the upper right-hand side, you can see that to get 1,000 milligrams of calcium, you would take 3 tablets. But again, of that 1,000 milligrams, you're going to excrete 500 to 600 milligrams of that. It's not going to be of any value to you. So when you're looking for a supplement, I definitely would go more in the 400 to 600 milligram range for the amount per serving, because otherwise you're just paying more money for something that your body is not going to use. And then in the lower right-hand side, this is a combination supplement. It's got calcium in it, which is 250 milligrams in 2 capsules. It also has magnesium, 250 milligrams per the 2 capsules. Magnesium is often a component of a calcium, vitamin D, magnesium supplement. I'm not really going to speak about magnesium today, but it is often in supplements. I don't necessarily promote that you need to buy a supplement that has magnesium in it. We're really focused on calcium and vitamin D supplementation. If you want to ask your provider, do I need to take magnesium as well, they can have that conversation with you. So, finding a supplement, while reading labels can be painful sometimes, finding a calcium supplement is probably for some people easier than getting calcium in their diet. But again, the best way to consume calcium is through your diet. So I wanted to show you a calcium food list. And you can get this information. There are so many websites out there that list how much calcium is in food groups. Again, the National Osteoporosis Foundation website, it's nof.org, has multiple lists on it. But if you eat a cup of collard greens, you're going to get 268 milligrams. Salmon has 181 milligrams, and that's with the bone. Sardines have a lot. Fortified orange juice has 349 milligrams in 1 cup. Fortified almond beverage, like almond milk, can have up to 442 milligrams. And then the winner of the day is yogurt, plain non-fat yogurt, 8 ounces, 488 milligrams. So what I'm trying to help you understand is that while we might not pay attention a lot to our food labels, all things are not equal. So 1 cup of yogurt doesn't equal another cup of yogurt. Read the labels. Some yogurts have a lot more calcium in them than others. And if you're going to be eating yogurt as a part of your plan to get the calcium that you need every day, then you want to be choosing the yogurt that's going to give you the biggest bang for your buck. So look at the labels and make your choices wisely. If you had a cup of yogurt in the morning, if you had some juice at lunch, if you had a salmon patty and some collards for dinner, sounds pretty good to me, then you have gotten all the calcium that you need basically in the food that you ate that day. Most people are not going to sit down and add up how much calcium did I eat today and then decide if they're going to take a calcium supplement. Our lives are really busy, and we are somewhat creatures of habit. So if you have a plan for this is how I'm going to eat as much calcium as I can, then what you can do is kind of average on a routine day, how much calcium do I take in, and then how much do I need to equal that 1,000 or 1,200 milligram level that's recommended, and then just do that. So just take an average of your intake and then supplement up to the 1,000 to 1,200 milligram level that your provider is recommending for you. Again, these lists are very, very easy to find on the internet. But again, you can do it without any list at all if you just read the ingredient labels. So we talked about vitamin D and that it is required for calcium absorption. Our body can make vitamin D, and the way we do that is when we expose our bare skin to UV light. Now, how much exposure is related to a couple of things. So how much skin is being exposed, and then the other thing that you need to think about is, are you using a sunscreen for that exposure on the skin that's exposed? So if you're like me and you have skin cancer, then you're putting sunscreen over your entire body. Well, SPF 8 sunscreen, so that's an 8. I use like a 52. It decreases your vitamin D production by 95%. So if I am very, very careful to always have on sunscreen when I go out in the sun, I'm basically not going to be making a whole lot of vitamin D, which means that I need to take a vitamin D supplement to make sure that my vitamin D levels are high enough to get that calcium into my bones where it needs to be. So understanding, if you're saying I'm going to rely on getting enough vitamin D based on my exposure, you need to make sure you're getting adequate exposure, and that also requires that you not have sunscreen on. And I think we've all heard enough about skin cancer to know that sunscreen is a good thing. So let's talk about what else can we do. When we talk about exercise, we're talking about weight bearing. So we want you to be up and moving around. So dancing, walking, running, anything where you're carrying the weight of your body and you're impacting that weight is going to strengthen your bone. So weight training, which is the picture in the middle of this screen, weight training puts pressure and force on your bones, and that will cause your bones to get stronger. Dancing and moving will cause your bones to get stronger. Playing pickleball or football or tennis, anything where you're up, moving, carrying your body's weight, impacting, is going to help you to be stronger. The picture on the left, upper left, one of our ladies has a yoga mat. Basic yoga is not going to strengthen your bones. It's going to make you more flexible and have stronger muscle, but you're not doing weight bearing or impact with a basic yoga class. Lots of people like to exercise in the water. So when you think about, am I weight bearing in the water, the answer is actually no. However, there are some pull tools that you can use that will put resistance on your bones while you're in the water. Those could be anything from the pool noodles to different things that you could hold and press down on. So if you could get resistance activity going while you're in the pool, then that will be some weight bearing or resistance, which will increase your bone density. But basically just being in the pool and swimming is not going to be a weight bearing exercise. We can translate that also into riding a bicycle, doing the elliptical at the gym. Those things are not going to increase your bone density because of the stress that you're putting on your bones. Now, it's great for your heart, and so I'm not saying don't do it, but as you look at your exercise, try every day to make sure you're getting some weight-bearing exercise in your exercise regime. So now, we talk about falls and fracture risk because if you are diagnosed with osteopenia or osteoporosis, you are at increased risk for fracture with a fall. So there are lots of guidelines that are available that will help you fall, quote unquote, fall proof your home. Things like handrails, grab bars in the shower, watching out for those throw rugs, sturdy shoes, all of those things that can help you to decrease the chances that you're going to fall in your home. There are some medical conditions that can make you be unstable on your feet. So if you take a medicine that interferes with your balance, then you might want to talk with your provider. You know, how can we find a happy medium between me needing to not fall, but me needing a medication that makes me unstable? And you might want to consider some balance exercises in that point. And then also your thought processes. So if you are somebody who's experiencing Alzheimer's, early dementia, those people are not as aware of the risk in their environment. And if you're a caregiver for somebody like that, it will be up to you to do as many fall prevention things as you can in their environment for them, because they are not as able to recognize the dangers. Just touching briefly on how osteoporosis is diagnosed. There are screening tests, so you can have a screening test at a health fair. All it's going to do is tell you normally the bone density of a finger. That's the test that's most common. Sometimes you'll test an ankle. Those are not diagnostic. So if a screening test comes out with a T-score that is very low, what they will recommend to you is that you take that to your provider and have a conversation, because you would need a diagnostic test to actually have the final say on whether you have osteopenia or osteoporosis. The most common and gold standard test for osteoporosis is called a DEXA scan, D-E-X-A. The DEXA scan is an x-ray of your spine and your hips, and then they run it through all kinds of algorithms to give you that T-score. And the T-score, again, if it's minus 2.0 or below, minus 2.5 or below, then you do have osteoporosis. There is a score that's online. It's called the FRAX score, F-R-A-X. You can find it at the website that's listed here. You can just Google FRAX, F-R-A-X score. It will take you to a page where you can actually do your own FRAX score. You need to make sure that you've selected that you are in the United States, because the algorithms for these tests are based on your geographic region. The FRAX score does ask for a DEXA score, and if you have a DEXA score that you can enter in there, that's great. If you don't, it's still going to give you a 10-year risk for having a fracture, but it's not as accurate as having that DEXA scan done. So this is something that you want to talk with your provider about. And when do you want to do this? Well, if you have, at whatever age, a non-traumatic fracture, your provider is going to talk with you about, well, I wonder what's going on that with that incident, you broke a bone. So that's a great time to have that conversation. Otherwise, for women, you can think about it as you're entering menopause. You can talk with your provider about potentially getting a baseline DEXA scan done, and then Medicare will start paying for DEXA scans at age 65. Now, if you have risk factors, then you are normally covered to have a DEXA scan done much earlier. And I want to remind everybody that if you're a woman, you have a risk factor. If you're postmenopausal, you have a risk factor. And then add on, you know, are you a petite framed person? Do you have a family history? Routinely, you can get a DEXA scan done working with your provider to identify those risk factors earlier than age 65. It's just that those things do need to be identified so that you would qualify for that test. And then once you have a normal one, you don't routinely have them done except for maybe every 5 to 10 years. Now, if you're diagnosed with osteoporosis or osteopenia, then you normally will have a DEXA scan done every 2 to 3 years to check to make sure that your therapy is working and that your bone density is where you and your provider want it to be. There are lots of medications that you can use for osteoporosis. I am not going to go over these. There are lists all over the internet. There are so many of them that many primary care providers now are recommending that their patients who have this diagnosis go to a osteoporosis clinic and have their osteoporosis managed by the experts at the clinic. New drugs are coming out every day. Lots of different drugs are out there. Some of them you may or may not qualify for. It depends on your medical history and also where your fractures are. So treating it can be a very complex process. And that's why we do have specialists who work in the osteoporosis clinics who help manage this disease process. So if you do have that diagnosis and your doctor says, I think I want you to go to the osteoporosis clinic, they're sending you to somebody who has a lot more experience and comfort level with all of the treatment options and all of the drugs that not only currently exist, but that are coming down the pipe. So again, these are just lists of all of the drugs. These lists you can find on any kind of website, but here, this list came from WebMD, which many people might be familiar with. The Osteoporosis Foundation website has a great list. You can find this information easily. I wouldn't try to tackle it without some guidance from my provider, because some drugs have side effects that may or may not be something that you can tolerate. Some drugs are specific for certain fractures. Some drugs you need to be the first treatment that you've ever had. Other drugs you won't take until you've tried 2 or 3 other treatments. So again, it is very complex. So what are the next steps here? Well, for you, I would say think about your risk factors and then talk with your provider about having a DEXA scan done if you haven't had one done and you have the risk factors. When you get those results, you'll talk with your physician and the two of you can decide what your treatment plan is going to be. But in the meantime, if you don't have any issues right now, you want to make sure that you're getting adequate calcium and vitamin D in your diet with your food or by supplementation. We talked about the weight-bearing exercises that you can participate in every day to increase your bone density and health, and we want you to do that. And then also, again, share this information with friends and family members, possibly people who are much younger. Help them to understand they can make deposits in their bone bank early, and then hopefully in 50 years their bones are going to be strong and healthy, and they're not going to have to worry about having osteoporosis. These are some of the resources that are available. Again, your provider is a resource. The Bone Health and Osteoporosis Foundation, I mentioned that. AARP has some great osteoporosis information. Medline Plus, the National Women's Health Information Center, and the list goes on and on. Notice that TikTok is not on this list. So, you know, social media is not the place that I would recommend that you go for medical guidance. Go to well-respected and informed websites, and then take that information and discuss it with your provider to make sure that you are interpreting it correctly. I really appreciate everyone's attention, and I hope that this has been helpful, and I look forward to possibly being able to speak with you again on another topic. We good?